Hello, in this video we're looking at diaphragmatic breathing and we're doing that in a sitting position, which is a step on from our lying diaphragmatic breathing. It's a good idea to practice this breathing if you feel that your breath is a bit tight or short or shaky or just not as relaxed as you would like it to be, or maybe you've been having some challenges with breathing. It's a good technique to learn. We're going to find a comfortable sitting position. I'm using some blocks here and I'm going to actually kneel so that I can sit onto my blocks. The important thing is to be upright and to have space through the front of the body. Now, if you find it helpful to place a hand or both hands onto the abdomen, then do that around the level of the navel. Get settled in a comfortable position, breathe through the nose. Steady your breath, steady the flow of your breath, and observe where you feel the movement in the body. So we're looking for movement underneath the hand. The hand coming forwards as we inhale, the hand returning back as we exhale. There's a sense of inflating and deflating. Hand coming forwards with the breath in, hand moving back with the breath out. And there may be very little movement or no movement in the rib cage. That's normal. If you've got a lot of movement in the rib cage, then see if you can direct your breath to be lower. But at the same time, we don't want to consciously push the abdomen forwards or pull it back on the exhale. We can do those in other practices, but for this technique where we want to work with a relaxed breath, we're looking for the movement, the main muscle controlling the breath to be the diaphragm, and the movement to be happening at the level of the abdomen. If you can feel your hand moving forwards and moving back without consciously controlling it, then you are practicing diaphragmatic breathing. Find a steady breath. It doesn't need to be a long breath, but find the steadiness in the exhale, in the inhale, and maintaining that. And then you're practicing diaphragmatic breathing. Once you get used to that sense of restfulness in the breath, then it feels really nice for the rest of the body too. The sense of ease in your breath transfers into the rest of the body and you get a sense of ease in the whole body. You can carry on using it for a considerable amount of time, or maybe even just for a couple of minutes if that's all you've got. So just before we finish, there's one thing that I wanted to show you to avoid, and that's when you're sitting, to avoid a sort of collapse into this area of the body, because then it's very hard to get that sense of movement of what's happening in the body. So if you're cross-legged, or if it helps a little bit to be sitting on something, but if you're sort of sinking down and the whole of the front of the body gets compressed here, it's difficult to feel that movement into the abdomen area. If you want to sit cross-legged, have a block or even a couple of blocks, which just gives you a bit more space through the front of the body. Good, and have fun trying it out and see how it makes you feel. I'm Barbara Dancer and I'm part of Yoga Therapy Whole Person Healing, and we use all of the tools of yoga to help support health and healing and well-being in our lives.